Dear friends, welcome to Know Thyself YouTube channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we considered the third cluster B or dramatic or erratic disorder, namely histrionic personality disorder in detail. In this episode, we will consider the fourth cluster B or dramatic or erratic disorder, namely Narcissistic Personality Disorder or NDP in detail. Narcissistic personality disorder belongs to the cluster B personality disorders, namely the dramatic or erratic disorders, which involve the affected persons displaying inconsistent or unpredictable thinking, intense theatrical or unstable emotions, and impulsive, melodramatic, or thoughtless behaviors. The term narcissist is a common catchword that describes a person who acts in a self-absorbed or vain manner. Narcissists tend to think too highly of themselves, expect acknowledgement and appreciation from others, and tend to look down upon others. Hence, narcissistic personality disorder is a serious mental health condition that involves consistent, pervasive, and long-term patterns of perceived superiority and grandiosity, excessive sense of self-importance, unwarranted need for praise and admiration, and complete lack of sympathy for others. These patterns of thinking and behavior often emerge from a feeling of inferiority, fragile sense of self-worth, low self-esteem, and lack of self-confidence. When you are suffering from narcissistic personality disorder, you display overinflated feelings of self-worth, dignity, stateliness, and superiority over others. You are unduly focused on your needs and wants. You are extremely preoccupied with yourself. You feel entitled to prestige and power and have a never-ending need for compliments. You see yourself, your interests, and your opinions as the only thing that matter. You have an unreasonable expectation of favorable treatment from others. You can be arrogant, self-centered, manipulative, and demanding. You exaggerate your achievements and talents. You have no capacity for empathy and cannot understand, care about, appreciate, or relate to feelings outside of your own. Yet you expect others to be empathetic towards you. Though you believe that you are destined to be someone great, you do concretely nothing to achieve that high status. Instead, you will handpick friends who would reinforce for you your destined ideal. You are oversensitive and intolerant to criticism, judgment, and defeat, and often exploit people who fail to admire you. Your rapidly changing emotions would make it hard to get along with others. Besides, other people may not enjoy being around you. Hence, it may be difficult to build and maintain an intimate and close relationship. And you may have relationship issues with your family members, friends, or co-workers. Similarly, this disorder can cause problems in other areas of life such as work, school, social life, and financial matters. Symptoms of narcissistic personality disorder are the following: having an unreasonably high sense of self-importance, seeking constant and excessive praise and admiration, unreasonable expectation of favors, privileges, and special treatment, taking advantage of others, fantasizing about success, power, brilliance, attractiveness, or the perfect mate, believing that they are superior and expecting others to recognize them as superior, even without any achievements. exaggeration of achievements and talents, failure to recognize others' feelings and needs, lack of empathy for others, instead exploiting and belittling them, being critical of and looking down upon people, being envious of others and believing others envy them, displaying arrogant attitudes and behaviors, insisting on the best of everything, difficulties in handling criticism and rejection, having difficulties in managing emotions and behaviors, becoming impatient and angry, reacting with rage and contempt, feeling easily slighted, having problems interacting with others, having trouble dealing with stress and adapting to change, fear of being exposed to failure and avoiding situations of failure, and having secret feelings of insecurity, shame, and humiliation. These symptoms can be mild, moderate, or severe. When symptoms are mild, the affected person would be self-centered and display ego-driven behaviors and cause occasional or minor problems. However, for the most part, he or she would function reasonably well. When the symptoms are moderate, self-centered and ego-driven behaviors can create considerable performance issues at work, school, home, and social situations, causing substantial risk to self and others. When the symptoms are severe, self-centered and ego-driven behaviors can lead a person to isolate himself or herself totally from others. Besides, they can display persistent suicidal, abusive, or criminal behavior and fail to maintain minimal personal hygiene, thereby cause severe risk to themselves and others. Symptoms of narcissistic personality disorder usually appear in the late teen years and early adulthood. Experts estimate that up to 5% of the general population has narcissistic personality disorder, and it affects more males than females. Though the exact cause of narcissistic personality disorder is not known, experts believe that it is caused by a combination of factors, as its emergence is linked to: first, genetic factors, family history, inherited traits, and hereditary passing of the illness from earlier generation to the later generation. Second, environmental factors, physical, sexual, and verbal abuse or other traumatic experiences during childhood, child's relationship with parents, friends, and relatives during the growing up years, and personality and temperament the child developed in the context of its childhood experiences. And third, neurobiological factors, namely the relationship between brain and a person's thinking and behavior. A combination of all or some of these factors can cause narcissistic personality disorder. We cannot prevent the emergence of narcissistic personality disorder because its exact cause is unknown. Its symptoms develop from early childhood and they appear only in late adolescence or early adulthood. Likewise, narcissistic personality disorder is a chronic mental health condition which cannot be cured. Hence, the prognosis for this disorder depends on the severity of the symptoms and the client's level of commitment to long-term treatment. For younger people with this disorder committed to treatment, the outlook is marginally hopeful. However, if the condition of narcissistic personality disorder is severe and the person is not committed to diagnosis and treatment, the prognosis and long-term outlook is negative. Hence, without diagnosis and treatment, narcissistic personality disorder can lead to a number of complications, namely relationship difficulties, problems at work or school, depression, mood and anxiety disorders, an eating disorder called anorexia, substance abuse disorders, suicidal thoughts and behaviors, and physical health problems. Hence, the importance of diagnosis and treatment. Diagnosis of narcissistic personality disorder is often difficult because people with this disorder neither accept that they have a problem nor seek professional help until their health condition becomes unmanageable. The process of diagnosis begins when the medical health provider, after a thorough physical examination, refers the client to a mental health professional. The mental health professional, after studying the condition of the client and talking about him to his family members and colleagues, makes a comprehensive psychological assessment to determine if the client is suffering from narcissistic personality disorder. It can be done by using the standard assessment criteria for narcissistic personality disorder, which includes the following. First, overinflated sense of self-importance. Second, constant thoughts about being more successful, powerful, smart, loved, or attractive than others. Third, feelings of superiority and desire to only associate with high status people. Fourth, need for excessive admiration. Fifth, sense of entitlement. Sixth, willingness to take advantage of others to achieve goals. Seventh, lack of understanding and consideration for other people's feelings and needs. Eighth, envying others and think that others are envying him or her. And ninth, arrogant or snobby behaviors and attitudes. If the mental health professional finds that the client has at least 5 of the above stated criteria, he can conclude that the client is suffering from narcissistic personality disorder and prepare a special treatment plan for the client. Treatment of narcissistic personality disorder includes medications, therapy, or both. Since there is no specific medications to treat narcissistic personality disorder, they are not used as the main treatment of the disorder. However, medications are used to mitigate mental conditions such as depression, anxiety, obsession, or compulsion, which co-occur with narcissistic personality disorder. Any therapy that helps the client to identify negative and distorted thoughts and replace them with positive ones based on reality, brings to the awareness of the client harmful inner dialogues and repeated maladaptive behaviors so as to replace them with healthy ones, guides the client in examining unresolved conflicts from involvement in past dysfunctional relationships, particularly with parents and other significant persons, and encourages dialogue between the client, the therapist, and other significant persons in client's life, can be used as part of the treatment process. By managing the conditions accompanying the narcissistic personality disorder with medication, learning to deal with the symptoms of the disorder through therapy, focusing on proper management of current living rather than focusing on long-term cure, and with the support of all who care for you, you can deal with the impact of narcissistic personality disorder reasonably well. In the next episode, we take up for our consideration the first of the cluster C, or anxious or inhibited personality disorder, namely the avoidant personality disorder, in detail. Thank you for watching this video. Stay blessed until we see you again with another video.